There are currently 3 anti-CD19 autologous CAR T-cell products approved by the FDA for the treatment of patients with relapsed refractory follicular lymphoma in 3rd line or beyond. Axi-cel, tisa-cel, and lisa-cel. Lisa-cel has been approved by the FDA very recently, so we really have only real-world data for the first 2. And the main difference from a biological perspective is that axi-cel is a CD28 CAR T product, so typically associated with higher rates of CRS or cytokine release syndrome and ICANS or immune cell associated neurotoxicity syndrome, whereas tisa-cel is a 4-1BB CAR T-cell product typically associated with lower toxicity. So we decided to perform this multi-center real-world experience. Multiple sites across the US participated, trying to assess whether there's any difference after, of course, proper matching for baseline characteristics in terms of efficacy and safety for these 2 products. What we saw is that, again, after adjusting for significant differences in baseline characteristics, the overall efficacy measured either as chance of achieving a complete remission at day 30 or day 100 or progression-free survival in follicular lymphoma was quite similar between axi-cel and tisa-cel, but as expected, even after matching, axi-cel was a more toxic product. So based on these findings, still the current practice in the follicular lymphoma community is to select Yescarta for the rare, young, and fit patients and reserve instead tisa-cel to the most commonly observed older and frail patient with follicular lymphoma. Again, as a reminder, follicular lymphoma, differently from large B-cell lymphoma, is a disease of the elderly, and these patients may have comorbid health conditions that may jeopardize the use of a CD28 CAR T-cell product such as axi-cel. The study overall, despite being multi-center, is still small, so we hope to generate larger data sets in the near future.